Thank you. Do you want to, close?
How are you?
Hi, everyone. Yeah, I think people are in now.
Hello, everyone. Welcome. We're excited to launch our new Derm 101 series, which will be a monthly series of interviews with basically highlighting one of our wonderful providers each time. Today we inaugurate with our new director of laser and cosmetic dermatology, Dr. Sarah Hogan. And she has joined us this past October, and we are thrilled to have her on our team. So thank you so much, and Dr. Hogan, welcome.
Thank you. Can you hear me okay?
We hear you fine. I think
Okay.
everybody else
Good.
let us know. And can you start by telling us a little bit about yourself?
Sure. I attended medical school in Chicago at Loyola University Chicago. And from there, I completed an internal medicine year and then 3 years of dermatology training at the Cleveland Clinic Foundation. After that, I completed a 1-year cosmetic and laser surgery fellowship. It's the oldest of its kind in dermatology in the specialty. I'm waving to people. That has faculty from Harvard, Brown, and Yale. It's at a place called Skincare Physicians. And then I joined UCLA following fellowship, where I was the director of aesthetic surgery at the Santa Monica site, where most of the lasers and cosmetics are done. I still am teaching faculty for medical students and residents there. And then I came and joined Laser Skincare Center for this great opportunity. So it's been great so far. It's a great work environment. I love the patients. There's lots of room to grow. So yeah, it was a good move.
We love having you here.
Thank you. Thank you.
I work very closely with Dr. Hogan. I'm the cosmetic consultant, so I get to ask her many questions all the time. So it's been great so far. Okay, so we're going to start this series by we've had some question coming in prior to this, so I'm going to ask those questions, and you'll answer them. And if anybody has further question after we're done with this session, as long as we stay within our 40 minutes, we'll be good. Then we can answer everybody's questions. Okay. All right. So I will start with what should I see a dermatologist for my cosmetic procedures instead of other places?
That's a great question. So just to give some background, when it comes to cosmetics in medicine, there are what are called core physicians, and there are 4 core groups, and those are specialties and subspecialties that are best trained to address cosmetics, because training matters. And those are dermatology, plastic surgery, facial plastic surgery, which often include a lot of ENTs, and then oculoplastic surgery. Those are the 4 core groups that are driving the research and do a lot of cosmetics. I think dermatologists particularly are well prepared because if you look at the armamentarium of what we use in cosmetics, if it's fillers, Botox, lasers, they've all been developed heavily with the help of dermatologists. Where I did my fellowship, did some of the first trials in the fillers that we all use. At MGH is where they developed the Fraxa laser as well as Cool Sculpting. One of the dermatologists in Maryland, along with a dermatologist, Mitchell Goldman in San Diego, developed sclerotherapy as we know it. And I think it's because dermatologists we operate all over the body. We have a really great understanding of skin tissue interaction when it comes with filler or light interaction with skin care as well. So that's the strength they have. But that being said, if there are things that I can't do, so I don't do nose jobs. I can do non-surgical nose jobs, but if a patient needs a nose job, I'm going to refer to a plastic surgery colleague or a facial plastics colleague. So we all complement each other in that way. If I do this all the time. I refer for oculoplastics, for eyelids surgeries all the time. A patient will come in thinking they need one thing and they need an eyelid lift, so they need to go to oculoplastics.
Okay. All right. Great. Those are good points. Second question is, if I have several cosmetic concerns that I would like to address, where would I begin?
I think the foundation is skincare. Obviously, I'm biased, I'm a dermatologist. But I think there are things you can do daily to make your skin the best it can be, so that all of the procedures you do end up looking the best and having great longevity. So we live in Southern California. Sunscreen every day, even in the winter on cloudy days, SPF 30 at least is a must. And that can prevent, it may not reverse the existing brown spots you have, but it can prevent you from getting more. A vitamin C to brighten, an active at night if it's a retinol or a prescription retinoid, or growth factors or peptides, something like that. So I think the best thing is to meet with a dermatologist at the start of your cosmetic journey to establish a great skincare routine, because then you're going to get more mileage out of the procedures you do.
Right. I've been asked before, and that's a little bit off, but how many times a week should someone use Retin-A or retinoid?
So retinoids, which are vitamin A derivatives, they stimulate the skin cells to turn over. Part of that, an expected issue, is for people to get some redness, some flakiness. That's normal. But what you don't want is to be so red, so irritated that you can't do anything else, and you don't want to even go out in the sun. So I think, 3 times a week, every other night, that's ideal. You don't have to do it every night if you have a good, you feel like the skin tone is very even, the texture is very even, just maintenance. It's when you stop for 2 to 3 weeks that then you lose the benefit. Because typically a retinoid just, takes at least 3 months to really work. And then once you are in a nice holding pattern, you want to just continue every other night or every 2 nights.
Got it. Okay, great. Third question that I got is there a limit to the number of cosmetic procedures that I can have done in one appointment?
The limitation is safety. So what you can do to minimize complications. And again, training matters, so it's really important to see someone who knows how to manage a complication if, heaven forbid, they do occur. So, for instance, you can do Botox and filler. They go hand in hand in the same visit. That's fine. If you are doing something like ultherapy, which is a tightening device using ultrasound, lower face, that's also fine if you're doing Botox upper face. If you're doing ultherapy, because sometimes you can get a little bit of swelling, or with some of the lasers, not all of them, which can cause a little bit of swelling to the upper face, you need to be careful with Botox, because Botox, not always, but it can migrate, and then you can have some what we call ptosis, where your brows or your eyelids are a little heavy. So you just talk to your physician before you approach your procedure, and you can plan. And some things you can do 1 week and then come back a couple of days later or the next week. It's not like you can't do it for the rest of the month. It's just a matter of planning.
Right. And make sure that the part is healed, whatever was worked on.
Yeah, so never to do things on completely. A needle injection with Botox or filler is one thing. That's fine. You can safely do stuff over that. You can do, for instance, a chemical peel. But when you have completely disrupted skin and it's raw, you increase your risk of superficial infection. So you just don't want to do anything at that time.
Got it. All right. Well, next question is, how do I prepare for a cosmetic procedure?
So the cosmetic consult with you, Olivia, or sometimes they'll do them with us, is extremely important. So first, I think foremost, understand the training of who's going to do your procedure. Make sure it's someone who knows what they're doing, has experience with this, and again, can manage a complication should it arise. I'm just drilling that home. The second thing is, when you meet with the person doing your consultation, ask all the questions. There's no stupid question about pre-care, immediate post-procedure care, post-care, that type of thing. When can I go outside? Because some of these have a little bit of downtime. And again, you want to optimize. You want to, make your money worth it. Your time that you've spent doing this procedure worth it. Ask questions, read, come prepared. We do have handouts that we give patients on certain procedures to make sure you go over that. If it's something that you need to have, come, like for instance with sclerotherapy, I like for my patients to come prepared with compression hose of a certain strength, because that guarantees the success of the procedure. So immediately after we're done doing sclerotherapy, you put on your hose so that you walk out of here. So you should purchase that beforehand, things like that. But during the consultation, that should come up.
Right, absolutely.
Yeah.
Okay. All right. Well, thank you for that. Fifth question is, what are the most common cosmetic concerns that people are coming into the office with during COVID?
So I think it's great that we're on Instagram Live and on Zoom, because I think what's happening is we're spending more time possibly than ever looking at ourselves and noticing little things.
On Zoom, for example.
Yeah, right, because we're spending hours looking at ourselves in the corner as well as talking to others. This is just the way we are living now. I think I'm having more patients come in. Skin texture is always and skin tone is always a concern. So noticing dark spots, noticing uneven texture. I have some uneven texture for my N95 that you can see today. But that's something people are coming in. I'm getting more than not laxity. And it partly has to do of the lower face with the positioning of the camera. I personally don't recommend that anyone take a call or look at Zoom with the camera beneath you. It's never flattering. But we do starting at early 30s, we start to get some laxity of the skin. There's also a change in the muscle tone. We have bone structural changes as well of the lower face. And so I'm getting a lot of that patients didn't notice before, but they're noticing now.
And I think the phone, we're all on our phone nowadays, and the posture that we all have, just kind of looking down at our phone or whatever it is, it's just, it feels like a lot more people now, even younger, are starting to get this, maybe not laxity if you're younger, but you have like this weird, weird layer right here that's starting to form.
Yeah, I think the term is called tech neck. And that's when you get the circumferential lines on the neck. It's actually controversial about whether or not this is even a thing, at least among cosmetic dermatologists. I think it's a thing. But it has to do with posture, and then we have muscles that contract over time. And then appropriately you get lines that are running perpendicular to where the muscles contract. Posture is always important, though.
Right.
Yeah.
It is. Posture is a big thing. Okay, and now the last questions, and then we'll go over our guests' question if they have any. Is there anything new regarding cosmetics at Laser Skincare Center?
Well,
ever since you started, especially.
Yeah, I think with the year we've had, there's been there was, a couple month pause everywhere across the country when it came to cosmetics. And one thing that a lot of us who do this for a living were wondering is, will there be demand when things get back to living in this new abnormal, is what I call it. And I think in part driven by being on the phone and Zoom, a lot of people are coming in now with cosmetic concerns. And we're just seeking to meet that demand, and that I anticipate will go into the 2021. Some great things that we're doing. So I like to do everything that's as evidence-based as possible. I like to know what data is out there. And part of that is based on photography, our befores and afters. So one good thing we're doing is we're redoing a photography suite to have the most accurate, unbiased before and after photos, so we can sit down after something's done and say, did this objectively make a difference? Are we meeting your treatment goals? So that's one thing patients can look forward. We're revamping our cosmeceutical or medical grade skincare lines that we carry. looking at what is something that really has a lot of evidence behind it, that you can only purchase at a physician's office, that can complement the cosmetic procedures you're doing. So 2 great lines that we're bringing on. One is called Skin Better Science. They have science in the name. They do a great job. There's also Elastin, which is a great a line. Also has a lot of great evidence. We have Sante that we continue to carry, which is a fantastic line as well. They have technology that no one else has in terms of really treating things deeper in the skin. And we also have the proprietary Laser Skincare Center line that we carry. So, but we're just revamping, looking at that. We're bringing back the chemical peel. That went by the wayside. A lot of people, I'm a laser person. I spent an entire year studying lasers. But chemical peels have a role. So we're bringing on a new chemical peel line that can be used in all skin types, from the most fair to the darkest skin safely. We just also brought on the latest in intense pulse light, which isn't a laser, but it's a light-based device that is used to treat pigment, texture, and redness. A new device that we just brought on, and you know, we're continuing to expand so that we can offer as much as we can for patients safely, and but also to get the best results. I'm really excited about the new lines in the photography suite, because I think that's what we need to be like, this is what we did and it worked.
Yeah. Absolutely. And that's wonderful. And you guys, good news too, we are able to bring back Fraxel. So anybody that had some consultation with me or with Dr. Hogan or other doctors at the clinic, and that were suggested to do Fraxel, just know that we are able to resume these treatments.
Yeah.
Facial, unfortunately, not at this time, hopefully in the near future. But Fraxel is exciting.
Yeah, we upgraded our PPE so that we can do it safely. Yeah.
Now, Dr. Hogan, you know, when she does Fraxel, she does look like an astronaut.
Yeah, that's the upgraded PPE. Next level.
Covered and coming out of her bag, and it's fun.
Yeah,
it's fun to watch. I'll have to take pictures and post them on Instagram so you guys can see.
Yeah.
Okay, so do we have any questions, people? You can start asking, guys.
Yeah.
I don't see any on. Oh, I see cost. Lars, if you could tell me a little bit more what cost you're looking for, maybe you can email us directly. We can talk about cost, or you can come see us for a consultation, because it depends on what you need.
Yep.
As far as other questions, do you have any on your side, Sarah?
I don't see any. Let me look. Oh, wait. Dr. Hogan performed V-beam on me on Tuesday. How soon should I expect to see the result? So that's a great question. The way the V-beam or the pulsed dye laser works is that it targets the blood that's inside of the tiny blood vessels that give us redness on our face, and the light targets it and essentially warms up and tries to destroy the blood vessels, and then the body slowly does its clearing mechanism to reabsorb the broken blood vessels. Typically, one treatment is not enough. Usually a series of treatments is needed. Results are usually expected. You'll start to notice things are not as red or pink 3 to 4 weeks. It's not going to be completely gone, but it should be better. And if people particularly have a lot of flushing, they should be flushing a little bit less, but usually you need to complete this full series. So I would say, you know, with that, you have a little, you're a little pink afterwards, or you can be a little bit puffy, 5 to 7 days, and then another couple weeks before you notice the result. There's another question, says, do the home light therapy devices work? That is a great question. There is limited data, and it's conflicting data. Some of the data is pretty promising, some's not. I'm actually working on this with 4 other cosmetic dermatologists. We've gotten together and we're looking at all the available data on these home devices. Some of them are home laser devices, some of them are home LED devices, so there is a difference between how they penetrate the skin. So I would say in general, You have to be careful about LED and laser devices. Some of them do stimulate in a way that's great. There's also, but you just don't know how deep it's going to the skin. So, I mean, technically it can't hurt. But until we have more data, I don't usually recommend them for patients. Do you treat sebaceous hyperplasia with lasers? You certainly can. I have, however, found that the best thing for sebaceous hyperplasia is good old school electrocautery, so the heat pen that melts the oil glands that make up sebaceous hyperplasia. But you can. There's a bunch of different lasers that can help. Fraxel's one of them. The Nd:YAG laser is another. And the IPL, actually, the intense pulse light.
Okay. Well, is that it for the questions? I don't see anything on Instagram at the moment.
Yeah.
Guys, ask away, take advantage of it.
Oh, I see this. Do you use the plasma pen? If so, does it work for around the eyes? The plasma pen is actually really old technology that they've updated and brought back. It's from the 80s. And what it does is it takes care of some of these, it's a superficial controlled burn, essentially, to stimulate collagen. We don't currently have it. Again, I have seen some good evidence that it helps around the eyes, but I also have seen a decent number of complications. So again, if you're going to pursue this treatment, make sure you know the training of who's doing it. And that tends to be when people overdo it and they burn a little too deeply. But it is promising. What lasers work for dark skin? So I think traditionally a lot of the lasers, the way they work is the targets that they have in the skin. We want to target sunbrown. We want to target redness. We want to target, deeper collagen to warm that up. When people have dark skin, they have a lot more pigment, and the pigment cells can be innocent bystanders that get knocked out. And sometimes people can end up with complications where things are darker or lighter, it's unattended. So traditionally, I think a lot of people shied away from using lasers in skin color, like my skin color or darker. And that is why I did a year of fellowship training. I think it depends on the person, their comfort level, their knowledge of how the laser device works. So in my hands, most lasers work safely in dark skin. I can't speak for other people, but it has to do with being a little bit more careful with the settings you choose, knowing that you're going to have to do more treatments than, say, someone with lighter skin, because you want to target what you want but not the stuff that you don't, that type of thing. In general, Clear and Brilliant is very safe. The Fraxel, done correctly, is safe. The Nd:YAG laser, which is for hair removal and also for a little bit bigger blood vessels, that's also safe. Intense pulse light, you have to be very, very careful with. The pulse dye redness, for redness laser, that can also be done if done carefully. But yeah, it just depends on who you go to. Okay, there's a question that says, is facial hair bleach safe to use if you are using Retin-A? Technically speaking, yes, but we do know that Retin-A can make the skin a bit more sensitive, and the hair bleach it never sits just on the hair, it sometimes will sit on the skin. So I would recommend taking a couple-day break of Retin-A before you do any type of hair bleach. Technically it should be fine, but I think that's it for any other questions.
I don't see any on Instagram, so
Okay.
I'm not sure on your end, because I know some people send them privately to you and you're the host.
Yeah, I don't have any others right now.
Don't have any others?
No.
All right, guys. Well, it seems, here's another one.
Oh.
What are your thoughts on dermal rollers?
Yeah, so derma rollers are home versions of microneedles that we have, medical grade microneedles that we have in the office. And so for those who don't know, they're handheld devices. At the end, they have tiny little needles, and they make little punctures over the skin. And when you have injury, it's in like columns with skip areas, normal skin, then it stimulates the surrounding normal skin to heal in. It's particularly great for texture. You know, you can get a little bit of improvement of tone, but it's mainly a texture is the strength. So the home derma rollers aren't going to penetrate as deeply as the medical grade, but they do something. You just have to be careful. I do see patients who come in with superficial skin infections, so make sure that every time you use it, you are sterilizing those needles. The problem is when you sterilize them, then sometimes it can blunt the needles, but they work if you can tolerate. You know, it can be a little uncomfortable to do it at home. We have, you know, numbing that we use in the office, but it's good for texture. It's just not going to be as great as what we can do in the office for you.
So I see one question from Beryl. She sent it to me privately. Thank you for holding this meeting. It's good to know to ask for when I need a consultation. Okay. Well, you're welcome, Beryl. We're very happy to be able to help.
Yeah.
And we're always here if you need us, for sure.
Yeah.
So I don't see any other question, but I had a question for the home dermal rollers actually,
Yeah.
because I know someone that uses it at home, and she was basically washing her face really good and using the dermal roller, and then she would put serum. Is it something that normally you can do to put the serum right after you did the dermal roller, or you shouldn't?
You can. The thought is you are creating microchannels in the skin that can then increase the penetration. However, it depends on the serum, and not all serums are created equal. Not all of them are meant to be put into the skin at that level, just and rather sitting on top and diffusing down. There have been reports, and I have personally seen patients who were using a vitamin C serum that they thought was safe, and it actually caused deep nodules in their skin. They had a reaction to it. So you have to be careful. But yes, that's in general, that's how people do it. They wash their face, make sure it's clean, make sure the roller's clean. They go over the areas. Don't press too hard, because if you press too hard, you can actually cause kind of, they look like track marks in the skin, like where you really are going after it, and leaving too deep of an impression. And then something bland is better than nothing. Sometimes you don't know what's in the serums that could be active.
Right. Okay, good to know. All right. I don't see any other questions. Do you see any, Sarah, on your hand?
One more. Nope, I don't.
No.
All right, well, this is our first
All right.
one. Thanks for joining us. Yeah.
Thank you, everyone, and we will have one monthly. The next one is going to be with Dr. Kane, and I will not sure of the subject yet, but you will be informed via email, and I'm sure she'll have some great subjects that we're all going to want to definitely listen to. So we will see you all soon, hopefully. Any question, feel free to contact us directly or email us or come on over safely, of course. And thank you, Dr. Hogan, for your time.
Of course. Thanks for having me. Yeah.
We will see you all very soon.
All right. Take care, everyone. Bye.
Bye.